I used to think I was broken. When I was a teenager, I had no understanding of my mental health. All I knew is that sometimes I had obsessive thoughts and behaviors, and other times I couldn't get out of bed. I didn't understand why my emotions felt so out of control. I didn't understand the impact they had on my body or my body's impact on them. And I definitely didn't understand that I could ask for help, let alone how to ask for it. I had no idea what to do or how to move forward. All I knew was that it meant I was crazy. When I was 18, my parents got me into therapy. I resisted this. I wasn't ready to be there. I didn't think I needed it, and I didn't understand the point. And I was immediately put on an antidepressant and anti-anxiety. A cocktail that came with the warning, may increase suicidal thoughts in teenagers. Just a little while later, I was committed to an inpatient psychiatric facility due to being prescribed medications that weren't appropriate for my brain. These experiences were followed by more mood stabilizers and further ingraining the belief system that there is definitely something wrong with me. So when I was 19, I asked my dad, "Why am I crazy?" To which he replied, "You're not crazy, you're just complex." This shift in perspective was the beginning of my journey to completely changing the way I view myself and my mental health. My name is McKenna Dempsey, and I live with anxiety and depressive episodes. And it is my goal to change the way our teenagers think about their mental health and make space for self-acceptance. Our society's approach to mental health tends to lean toward prescription medications that, yes, can be helpful in many cases, but are not the whole solution. We end up feeling like we need to be fixed. But the thing is, we're not broken. Currently, 20 million teenagers live with a mental health disorder in the US, and those are just the ones we know of. And 70% of these teens are not getting the treatment they need, while half of them are afraid of being judged by their peers for even seeking help in the first place. Yet, 71% of people believe that mental and physical health should be viewed as equally important. So why do we have an ongoing list of weight loss apps, fitness apps, and apps that support you while you're working through physical therapy, despite the amount of pain meds you're on, but so few apps that provide the same support for your mental health while you're on antidepressants or mood stabilizers? And zero designed specifically for teens, our most vulnerable population. Our teens deserve accessible mental health education and support on their mental health journey, but instead, we are simplifying the solutions we provide them. But these are complex issues, and they require complex solutions. I think that if I had known that earlier, I would have spent fewer of my teen years thinking that I was broken. So that is why we've created Kamber. Kamber is dedicated to creating mental health experiences that shift the perspective from I am broken to I am complex. And our first initiative is a mobile app specifically for teenagers. It has 3 goals: provide teens with a safe space to explore their emotions, give them the opportunity to educate themselves about their mental health, and cultivate self-compassion and acceptance. We do this by taking them on a journey. No matter where they are, living with ongoing daily challenges or battling panic attacks, we help them manage heightened emotional responses, learn new exercises that help them cope on a daily basis and get education and resources, and provide them with a way to consciously choose to accept themselves for who they are. When I was a teenager, my unstable mood and inconsistent emotions caused me so much confusion that knowing where to start wasn't even an option. That's why we've broken down the path to self-understanding in a way that makes it easy to get started, no matter what stage you're at in the process. So a 14-year-old girl living with severe mood instability will learn how to process the roller coaster of her emotions in a healthy and productive way by acknowledging how she is feeling physically and emotionally and allowing herself to sit with it. Before Kamber, her emotions would have felt unbearable and overwhelming. She will have access to tools and exercises that not only teach her new techniques for managing anxiety and emotional discomfort, but will provide her with understanding why these techniques even help in the first place. A 16-year-old boy struggling with crippling social anxiety will have access to coping strategies he can use before going to homecoming, an experience he otherwise would have missed. And he will be able to learn how his mental health plays a part in his daily life. And an 18-year-old woman preparing for college and living with self-doubt, fear, and pressures to be a certain way will take a pledge every single day to accept herself for who she is. because acts of self-acceptance have been proven to decrease depression by 24% and anxiety by 20%. This self-acceptance tracker allows our teens the space to say, yes, I accept myself fully, ups and downs included. At all stages of their journey, these teens will have access to resources that empower them to prioritize their mental health. We are not here to fix these teens. They are not broken. They are learning how to adapt to the world while facing the mental health challenges they take on every single day. And we are here to support them and provide them with resources to do so. Our team consists of me and my co-founder, Ron Sparks. Ron's technical expertise in product design and management brings immeasurable value and has given us the opportunity to bring this app to life. We are working closely with mental health professionals who are not yet officially on the advisory board, but intend to be soon. These mental health professionals validate and help us create the exercises we are bringing to life. On April 1st, we are releasing the first version of this app, and our biggest priority is getting it into the hands of our users. So if you know any teens who would be interested in testing, please visit our website to sign up. From here, our goal is to partner with public and private schools to bring mental health solutions into the classrooms and provide parents, teachers, and students with resources that allow them to prioritize their mental health through programming and education, and develop additional partnerships with mental health organizations to provide adolescent patients with resources outside of the therapeutic setting. Because of this, we are seeking connections to mental health organizations in both public and private schools in the Portland area. Our vision is to create a space where we love ourselves for who we are, embrace our mental health needs, and get to be just as complex as we were born to be. Thank you.